Hi everyone, and welcome to today's webinar, the Brisbane North Public Health Unit Immunisation Update for practice nurses, GPs and pharmacists. I'd like to begin today by acknowledging the traditional owners of the lands on which we meet today and pay our respects to elders past, present and future, for they hold the memories, the traditions, the cultures and hopes of Aboriginal Australia. If you have any questions throughout today's session, please pop them in the Q&A chat box, and if we have time, we will try to answer these at the end. Any questions we don't get to, I will include the answers when I send the slides and this recording. We do appreciate if you can complete the evaluation survey that it will open up when you leave the session. This will help to ensure that we continue to provide relevant information for you all. As I've mentioned, we will be recording today's session and we will be able to provide a copy of the recording along with your certificate of attendance and the slides. These will be sent out to the email address you registered with within the next couple of weeks. Also, please note we are only providing certificate of attendances to those that actually registered for today's session. I understand that people may be watching from the same computer in the practice, that's fine. But as long as you do still need to register that you're going to come, and I assume that you will sat in on that session on the day. Please be aware that each state does have a different immunisation program governed by their state public health unit. So the information provided by the Queensland Health Public Health Unit may not be relevant to some people attending from other states. The information provided at this webinar is specific to Queensland, and we recommend that you check with your local state public health unit for localised information. All information provided in today's session is current as at today. Please refer to the public health unit if you have any queries. Their contact number is 07 3624 1111. And today's presenter is Michelle Ferguson-Hanna, one of the clinical nurses with Metro North Public Health. So I'll hand it over to Michelle.
Perfect. Thanks, Amy, and thanks to the PHN for hosting today's webinar. I'm just going to share my screen and hopefully you can all see those slides.
Yep, I can.
Okay, perfect. And I'll just let you know as well that today I am presenting from home. I have my two dogs here, my Cavaliers. So hopefully you don't hear any barking or snoring from them. I have asked them to be on their best behaviour, so we'll see how that goes. Okay. So sorry, Amy, just confirming you can see that first slide for me?
Yes, I can.
Yep, great, thank you. Okay, I'd like to acknowledge the traditional owners of the lands on which we are meeting today and pay my respects to elders past, present and emerging, and extend that respect to any First Nations people joining us online today. So thank you again to everybody who has taken the time to join us online today. We do have a fair bit to get through. So in terms of overview, we will talk about the flu program, RSV, UTI and travel vaccines, Australian Immunisation Register and Extended Practice Authority updates, vaccine management and storage, and the FAQs that you guys have submitted in as well. I have tried to include as many links to resources as possible so that you can find the information that I'm presenting today. But pretty much all of the information within the slides are from either the Australian Immunisation Handbook, the National Centre for Immunisation Research and Surveillance, or NCIRS, the Queensland Health Immunisation website, or the Australian Technical Advisory Group on Immunisation, or ATAGI. Okay, flu. So we had an update from the Queensland Health Immunisation Program last week to say that across Queensland there's been around 1 million doses of flu vaccine recorded on air. That is slightly lower to the same time compared to last year. There was sort of queries around whether the cyclone and the rollout initially of the flu vaccine could have kind of resulted in that slightly lower uptake. And I just sort of wanted to note again that a recommendation from a healthcare professional such as yourself obviously influences the patient's decision to get vaccinated. So please keep recommending the flu vaccine for all your patients 6 months of age and over. It is a really important vaccine, and we want to make sure that we've got as much coverage across the state as possible. So you would be aware, very similar to last year, we've obviously got the NIP flu program and then the Queensland free flu vaccination program. So this is regardless of Medicare eligibility. So we really don't want any patient currently residing in Queensland to be out of pocket for any flu vaccine. I've included a link there to the Australian Immunisation Handbook, the flu chapter. Obviously, that's got a lot of key information about administration. And then obviously there's a lot of good information as well in the ATAGI statement that was released for the 2025 flu program. You probably will have also received the Immunisation Service Provider Stakeholder Toolkit from Queensland Health. If not, I've included a link that you can access after the webinar as well. So ordering flu vaccines and reimbursement, it hasn't changed from last year. So you can order your NIP funded vaccines through, so your National Immunisation Program funded vaccines through QIP, the Queensland Health Immunisation Program. At the moment, you can place orders weekly until Friday the 1st of August. And then it will continue back to regular fortnightly orders. Just make sure that you've got the correct order form. If you're a pharmacist, there is a specific order form for pharmacists. And your private flu vaccine should be continued to be purchased via your wholesalers. Reimbursement, same as last year. So you can place your submissions no more frequently than fortnightly. And the final reimbursement submission will be due by the 31st of October. Unfortunately, you cannot claim for any private stock which hasn't been administered. It's a fixed rate of $25 for privately purchased and administered flu vaccines for non-NIP eligible people during the program date. So that's the 1st of March to the 30th of September. And I've just included the link to the Queensland Health site where there's further information about the reimbursement, but please give us a call if you're having any queries about that as well. I just wanted to mention the transition from quadrivalent influenza vaccines back to trivalent influenza vaccines. You might recall probably in 2016, I think, we used to have the trivalent influenza vaccine. So ATAGI has released a statement about the transition. So they've said that during the transition, they will support the use of either a quadrivalent or a trivalent influenza vaccine. Currently, all NIP-funded flu vaccines this year are still quadrivalent. But it is anticipated that from next year, we will be back to exclusively using the trivalent influenza vaccines. And the reason for that is the B Yamagata component is no longer circulating, so it's not needed in the seasonal influenza vaccine anymore. I've just included a link there to the ATAGI statement if you want to read any more about that. So NIP eligibility for funded vaccines, it hasn't changed from previous years. So just to recap, your NIP vaccines are for your children 6 months to less than 5 years. People aged 65 years or over receiving the FLUAD quad, Aboriginal and Torres Strait Islander people 6 months and over, pregnant women, and then anybody 6 months and over who has a medical condition associated with an increased risk of complications. And I've just included the table from the handbook which outlines those medical conditions. So if they don't fit into these categories, then they receive your private stock of flu vaccine and then you claim a reimbursement. So the ATAGI clinical advice from February 2025, hopefully you guys have all read that document. and also the Department of Health NIP advice for health professionals. I've just included the links for those two documents. Obviously, within there's also information about which vaccine is registered for which age group. It's very complicated. There's lots of vaccine available. Really, the key message from us here at Public Health is that we want you to make sure you have the right vaccine for the right age group. So that in itself is obviously tricky. And then when you add in, an additional component of which is NIP funded, which is Queensland needing reimbursement, it gets pretty tricky. But we don't sort of get so hung up on the funded aspect. It's more just making sure you've got the right vaccine for the right age group. And again, you will have seen a similar poster from last year, the vaccines that are available and registered for each age group on the NIP. Key information. So these are questions that we sort of field each year. A lot of it hasn't changed from previous years. So people with an egg allergy, including a history of anaphylaxis, can safely receive the egg-based or cell-based influenza vaccine unless there's another reason that it would be contraindicated. If you have significant healthcare concern or parental concern, you can observe them in the clinic for up to 30 minutes. No vaccines in Australia contain any latex, so they're all safe to give for people with a latex allergy. People with a history of Guillain-Barré syndrome, influenza vaccine is generally not recommended if their first episode of Guillain-Barré syndrome was within 6 weeks of receiving an influenza vaccine. Flu vaccines can be given with pretty much most other vaccines. So if you need to give influenza and Prevnar together, particularly to children 6 months to less than 5 years, there is a small risk of febrile convulsions for those children when they receive both vaccines at the same time. We obviously want you to let the parents know about that risk, but also let them know that it is okay for them to have them together. If there is a lot of concern from the parent, you can also administer them separately. I guess we just don't want to miss an opportunity where they don't come back for the second vaccine. Fluad, Quad and Shingrix. So this has been slightly updated in the handbook from last year. So they are happy for them to be co-administered on the same day, or they can be given at any time before or after. And recent data shows that there's been similar rates of APHIs reported when Shingrix is co-administered as compared to when it's administered alone. Pregnant women, so we really want to make sure that all pregnant women are vaccinated. They can receive the flu vaccine at any stage during the pregnancy. If a pregnant woman received the 2024 flu vaccine early in their pregnancy, we still want them to have a 2025 vaccine now that it's available this year. If women receive a vaccine before they become pregnant, we want them to be revaccinated during pregnancy. And we know that vaccinating pregnant women can provide protection for infants up to 6 months after birth, at which time then they will be eligible for the vaccine. This information hasn't changed either. So children 6 months to 9 years, when they're having the flu vaccine for the first time, they need 2 doses 4 weeks apart. And that's to maximise their immune response. It's the first time they're having the vaccine. If a child, for whatever reason, if a 5-year-old presents and it's their first year and they only had 1 dose and you see them next year, that's okay. You don't need to catch up a second dose if it was missed from a previous season. So you just give 1 dose in the current and future seasons. For stem cell solid organ transplant recipients, if they're receiving the flu vaccine for the first time since transplant, then they're recommended to have 2 doses 4 weeks apart and then 1 dose annually thereafter. And for the select few that do need 2 doses in the same season, a different brand can be used. Again, we just want to make sure that you've got the right vaccine for the right age group. What have I done here? Okay, hopefully has that moved along now? Yep, best protection, here we go. So we know that the best protection is around 3 to 4 months after receiving the flu vaccine. It is never too late to vaccinate. We want you to continue to offer and recommend the vaccination while you've still got vaccine available in your fridge. Revaccination later in the same year, so it's not routinely recommended, but it could be considered for reasons such as travel or individual risk factors. And if a person had a 2024 flu vaccine late in 2024 or early this year, we still want you to recommend that they receive the 2025 formulation now. Adults 65 years and over should have the adjuvanted fluad quad, which is NIP funded. If for whatever reason you've got an adult over 65 and they had a standard flu vaccine, you don't need to provide an extra fluad quad in the same season. Again, before administration, we just want to make sure that you've got the right vaccine for the right age group. Obviously check air before giving any vaccinations, and just, obviously report the vaccines to air. I thought I'd just include an update for COVID vaccines. So the ATAGI statement was released on the 27th of March, outlining the ongoing eligibility and recommendations. So all adults are eligible to receive a COVID vaccine every 12 months, and they may consider that based on individual risk factors or a discussion with their healthcare provider. Adults aged 75 and over, however, are recommended to receive the vaccine every 6 months. And COVID vaccines can be co-administered with other vaccines for people over 5. And obviously all COVID vaccines are funded. I thought I'd just include a link to the AUSVAC safety report that was published in November 2024. So if you're not aware, AUSVAC safety is an active vaccine safety surveillance system. You might have it established in your practice. It is led by NCRS, and it was established in 2014 to monitor flu vaccinations. Now it's been expanded to include COVID, Mpox, NIP vaccines, RSV vaccines, Shingrix. So there's the link to the report there if you want to read more about that. Okay, we'll move on to respiratory syncytial virus. Probably you guys are pretty much across the pediatric RSV prevention program. I know that it was mentioned and discussed in depth at the previous immunisation update. So just a bit of a recap today about any changes. So obviously RSV is a common cause of hospitalisation and deaths for infants, particularly. The RSV prevention program was expanded on the 1st of December to include a pregnancy vaccine, a Brisvo. So the first opportunity to provide protection for the infant is for the mum to receive a Brisvo in pregnancy, and that's under the National Immunisation Program funding. The second opportunity, if it's needed, is Nirsevimab or Beyfortus, the monoclonal antibody, which can be given up to 8 months of age, and that's under the state-funded program. And then for any infants at high risk, and I've just included the link there that outlines those risk factors, so they can have a second dose ahead of the second RSV season, and that's as per the state-funded program. So a Brisvo is the maternal RSV vaccine, recommended between 28 and 36 weeks of pregnancy, and it will provide protection against severe RSV disease from birth up to 6 months of age. So the dose should be offered year-round. A Brisvo is the only vaccine approved for use in pregnancy. The dose ideally should be administered at least 14 days before delivery to ensure that there's enough protection for the infant. If a Brisvo is not administered before 36 weeks, please still give it, and it is still funded. And then for Beyfortus or Nirsevimab, which is a long-acting monoclonal antibody, it will provide protection for infants against severe RSV disease for at least 5 months after administration. So the recommendations now for for Nisivimab, if the infant was not protected by Abrysvo from birth. So if Abrysvo was not administered during pregnancy, or if the infant was delivered within 14 days of the mum receiving Abrysvo, or if you don't know whether or not the mum received Abrysvo, or if the infant has a condition associated with an increased risk of severe RSV disease. They are the indications for the Nisivimab or Beyfortus to be given. And just as well, I've included the link to the clinical guidance document here, but just to note that eligible infants who have had prior lab confirmed RSV are still eligible to receive the Nisivimab if needed under this program. And the AIH has a really good RSV flowchart, which outlines when Nisivimab is needed or not recommended. So basically, it's not recommended for infants during their first 6 months of life if the infant's mum received the RSV vaccine at an appropriate time during pregnancy, so within 14 days of delivery, and if the infant does not have a risk condition for severe RSV disease. And the immunisation unit did send around their newsletter, I think, early last week. And if you just have a look, there was a surveillance report that I've included a link to as well about the program. So at the moment, the updated data actually shows about a 70%. I think it says 49% there. But updated data shows about a 70% reduction in RSV-related hospitalisation infants for children 6 months and under since the start of the program, which obviously is a fantastic result and obviously a good reason to keep the program going. More likely now that you'll be obviously administering Abrysvo to the pregnant women and less indications for the Nisivimab or Beyfortus to be given to the bub. Administration, so Abrysvo, a single IM injection for pregnant women at 28 to 36 weeks gestation. Abrysvo is the only RSV vaccine approved for use in pregnant women. There's no advice currently on repeat vaccination for subsequent pregnancies. It can be given beyond 36 weeks, as I mentioned. If Abrysvo is given before 28 weeks gestation, there will still be protection for the infant and you don't need to give another dose. And Abrysvo is recommended for pregnant women of all ages, so including those less than 18 years. For Nisivimab, it's given IM into the anterior lateral thigh of infants for under 12 months of age and deltoid for children over 12 months of age. It's a weight-based dose for their first season. So less than 5 kilos, they get a 50 milligram injection. If they're over 5 kilos, it's a 100 milligram injection. And then if you have young children who are eligible for a second dose, then it's a 200 milligram dose, preferably separate limbs, but during the same visit. And you just need to make sure there's a minimal interval of 6 months between the first and second doses. And I think there was an update from QIP within the last month or so that the 100 milligram of Beyfortus or Nisivimab doses are available to order again. So Abrysvo can be given at the same time as other routine pregnancy vaccinations, so pertussis and flu, and it can also be given at the same time as anti-D or COVID vaccines. And I've just included a table from NCRS that I'd found, which talks about the antenatal vaccines and when they're recommended to be given. Nisivimab ideally should be given before discharge from hospital if it's needed, and it can be co-administered with the birth and routine childhood vaccinations. Administration errors. So the immunisation schedule is becoming more and more complex. We're having a lot more immunisation, a lot more vaccinations and immunisation products And obviously, we're here to support you if you have any concerns about any administration errors. But I just thought I would include this document also from NCRS specific to administration errors for RSV immunisation products. Hopefully you don't need it, but it is a really good resource to have available if required. So it talks about the type of errors, site route, the incorrect product being used. It will provide information on if a repeat dose is recommended. And there's also a section down the bottom that talks about informing the patient or the parent, ensuring that open disclosure occurs, reporting the administration error, which we'll go through those forms in a little bit as well, following any advice about repeat doses, and then reviewing how the error occurred, and I guess sort of trying to prevent it from happening again in the future. And the immunisation unit within their newsletter, they also provided this good table just around the indications for use for the vaccine versus monoclonal antibody, which I've just included a link to as well. Some more links for resources. So the clinical guidance document from Queensland Health. There is also an RSV prevention webinar hosted by the Immunisation Coalition on the 3rd of June, if you'd be interested in registering for that. And NCRS have a lot of new and updated RSV resources available on their website as well. Okay, RSV for older adults. We have been getting a lot of questions about the options for older adults. We know that RSV is still a common cause of hospitalisation for older adults, for Aboriginal and Torres Strait Islander adults and people with medical conditions. So the current recommendations are for adults over 75, Aboriginal and Torres Strait Islander adults over 60, and adults with over 60 with medical risk conditions. They are all recommended to receive the RSV vaccine. And then adults aged 60 to 74 without medical risk condition or who do not identify as Aboriginal or Torres Strait Islander can consider the RSV vaccine. Obviously, these would be privately purchased. There is no RSV vaccine available for older adults on either the NIP or state-funded programs. So there are 2 RSV vaccines available for older adults, Brisvo and Arexvy. So Brisvo can be used in over 60s as a single dose, and Arexvy, just recently the TGA approved the use in adults 50 to 59 at increased risk of RSV. I think when I checked the handbook last, it was still in adults over 60, so I imagine that will be updated shortly. Both a Brisvo and a Arexvy for older adults provide good protection against severe RSV disease. So there's an 80 to 95% reduction in severe lower respiratory tract infections following vaccination. It's expected that immunity lasts for at least 1 complete RSV season, but there's no information or recommendation yet for a booster dose. And as I mentioned, they're privately purchased vaccine, not NIP funded, not state funded. And just a reminder that Arexvy is not registered for use in pregnancy. For co-administration, so older adults can receive RSV vaccines at the same time as flu, COVID, pneumococcal and shingles vaccines. And also if a person has recovered from RSV infection, they can still have a vaccination. And I've just included a link there to a webinar from NCIRS, which talked about flu, COVID and RSV, and also the summary of the efficacy and safety for RSV immunisation products. Okay, UTI and travel vaccines. So I wasn't aware of the UTI vaccine. It only came to my attention after the last update when there was a request for some information about this vaccine. So it's Euroimmune, think that's how you say it. It's not currently TGA approved, but it can be accessed via the Special Access Scheme. It's sort of outside of the remit of public health. You know, it's not on the NIP, it's not a state-funded vaccine. So there's not a lot more information that I can probably provide for you today. But I have included the link there for TGA approval and how to obtain it, and just a link to an article that I'd found that talked about the efficacy as well. So I guess maybe watch this space. If we receive further information, we will certainly update you. So travel vaccines, the Australian Immunisation Handbook has a really good section on vaccination for international travellers, and this infographic is from there as well. So basically there's 3 types of travel vaccines. We want you to make sure that travellers are up to date with their routinely recommended vaccines, identify if they need additional vaccines based on where they're travelling and activities that they might undertake, and then determine if they need any additional vaccines such as yellow fever to meet any international health regulation requirements. There's also a really good section in the handbook about pregnancy and immunocompromised travellers as well. I thought I'd just mention a couple of specific vaccines. So Mpox, you're probably aware a little while ago that the eligibility was expanded in line with the ATAGI recommendations. So you can now provide pre-travel vaccine for people travelling to countries with clade 1 Mpox transmission. And there's just a link to the eligibility criteria. MMR, very topical at the moment. So we really want you to be checking if patients have immunity to MMR. That's all patients of all ages. But aside from that, if you do have any infants, young infants travelling overseas, please know that they can receive the MMR from as young as 6 months of age, particularly if they're travelling to where measles outbreaks are occurring, which at the moment, you know, that's sort of everywhere. If the first dose of MMR is given between 6 and 11 months of age, the child still needs to receive 2 more doses. So that would be given at the scheduled points of 12 months with the MMR, or just making sure it's 4 weeks after a previous dose. And then they would still have the MMRV at 18 months of age as per the NIP. And this early, or the sort of first dose that you give, it's funded. So please encourage any travellers to receive that dose, and please know that it's definitely funded. And yellow fever, so travellers might need yellow fever vaccine to meet a country's entry requirements, or if they're travelling to an area with a risk of yellow fever virus transmission. And obviously yellow fever vaccine can only be administered at accredited yellow fever vaccination centres. And if you did want to be considered for accreditation, you could reach out to Public Health and we can provide you the relevant documents that you need to complete for that. Within the frequently asked questions section of NCIRS site, there's also a really good table around travel vaccination, which outlines the minimum age that vaccines can be given for travel. So for example, you can see sort of halfway down that table, yes, MMR can be given from 6 months of age. Rabies, for example, can be given from birth. Meningococcal, ACWY and B can be given from 6 weeks of age. If we have any pharmacists online, I'm sure that you're probably aware that travel health has been included in the Queensland Community Pharmacy scope of practice. There is a lot of information available in the clinical practice guideline, which I've included a link to, and it just outlines, you know, components of the pre-travel assessment, including patient history, travel history, itinerary and travel dates. And also you're probably aware that rabies pre-exposure vaccine has now been included in the pharmacist's extended practice authority. And I've just included a link to the Queensland Health site around the community pharmacy pilot. And within that clinical practice guideline, there's a lot of other pharmacy resources for you to have a look at as well. How are we going for time? Okay, so on to Australian Immunisation Register updates. So you know it's mandatory to report NIP, COVID, flu, JE vaccines, but obviously we strongly recommend that you report all vaccines to AIR. And you will know from the 1st of March, it's now mandatory to report the pregnancy status at the time of vaccination. So hopefully your software is doing that for you, and you have this antenatal indicator where you can select if they were pregnant or not. You may or may not have seen a warning message as well from AIR when you enter some flu or RSV vaccine. So for example, if you're entering a fluad quad for somebody less than 65 years of age, you should receive this error alert, and we just want you to check that the data that you're entering is correct. If not, to change and select a different vaccine. Otherwise, if an incorrect vaccine has been given, then you need to follow up and report a vaccine administration error. If an incorrect vaccine has been given, please give us a call around any revaccination advice, risk mitigation strategies. Please know that we are not here to judge you harshly about vaccine administration errors. What we really want to do is provide information around any revaccination needed, and talk to you about strategies sort of how to reduce that risk going forward. A reminder that the vaccine type and batch number are mandatory fields, and the vaccine route mandatory field for JE vaccines only. I've just included some resources for AIR learning modules, how to delete a vaccine from AIR, how to check that your the accuracy of an encounter before sending it to AIR as well. And AIR reports, so just for your awareness, the Health Contact Centre will be sending out some comms to potentially some of your patients if they're overdue for Shingrix and pneumococcal vaccines, and it will just ask them to reach out to their doctor or pharmacist to receive those. And a reminder that you can run your own reports, due and overdue, and send out targeted messaging. And also just, I think, an update from last week that facility and clinical managers within RACFs will now be able to access AIR, which will allow them to identify, residents that are due or overdue for vaccinations. Okay, extended practice authorities. So under the Medicine and Poisons Act, there's been legislative change in terminology, and these came into effect on the 7th of April. So the word vaccine has been replaced with immunisation medicine. So that is to allow for products such as nirsevimab. So that means that a VSP, vaccine service provider, is now an immunisation service provider. Vaccine management protocol is now an immunisation management protocol. And the immunisation website and documents are in the process of being updated. And QIP registered service providers can again transfer immunisations to other QIP registered immunisation service providers. And just a reminder, if you are transferring vaccines between providers, to complete the transfer form. So this was just a summary of the changes and a link where you can access it, but we will go through it. So EPA pharmacists, new update. So there's been the addition of Mpox for individuals 2 years and over, the addition of rabies vaccine for 2 years and over for pre-exposure prophylaxis only. If they need post-exposure, please contact us at Public Health and we will arrange funded vaccine. And the addition of age restriction for 2 years or over for RSV antigen. For the registered nurses, Mpox has been added, and there's also been amendments to diphtheria, tetanus, pertussis, and meningococcal to allow RNs working under Part C authorisation to administer those vaccines. There's also been the addition of a treatment dose of Panadol for children under 2 when receiving Bexsero. And for midwives, there's been the removal of the requirement for immunisation training course completion prior to them administering immunisations as part of the routine prenatal care. Vaccine storage and management. Okay. So obviously you would be well aware that vaccines need to be stored safely between +2 and +8 degrees. Repeated exposure to temperatures outside of these ranges diminishes the vaccine potency. The effect is cumulative and it cannot be reversed. We want to ensure that you have efficient vaccine storage and management to ensure that problems are detected and picked up before an ineffective vaccine is used. That's really what we're trying to avoid, anybody needing to be revaccinated because they had an ineffective vaccine. Please make sure you're checking your fridges and recording the temps twice daily and reviewing your data log readings. If you do need to report a cold chain breach, you should be able to access the cold chain breach reporting form, but please give us a call if you need any assistance. And please make sure that you isolate affected vaccines and let everybody in the practice or the pharmacy know not to use any of those affected vaccines until advice has been provided from public health. Some key recommendations. So Appendix 2 of the current Strive for 5 guidelines will provide you with the vaccine storage self-audit that you can print out. We would like you to do that every 12 months. It is an important part of routine quality assurance and allows you to know that you are providing safe and effective vaccines. If you have, so please plan for a power failure or a fridge malfunction. They do happen. We want you to be prepared. Make sure you have enough esquies for the amount of vaccines that you have in your fridge. Make sure you have 1 thermometer per esquie. Keep an accurate record of your temperatures if you're having to transfer them to the esquie. And if you're using multiple esquies, please record which vaccines you have in which esquies. And the Strive for 5 again has a chart that you can use to record the temperatures. And there are some training videos available on the Queensland Health website, and one of them includes how to pack an esquie as well. So I'd recommend having a look at those. So the immunisation management protocol, formerly vaccine management protocol. So we want you guys to have a current immunisation management protocol and update it every 2 years or more frequently if required. So if you've got new equipment or staff, please update it and send it through. Previously, we'd asked for these to be updated yearly, but we have more than 500 service providers, so we just don't have capacity to review them on a yearly basis. So we're moving to two yearly. There is a statewide template available, which has been updated with the new terminology. So if you're due to do an update, please let us know and we can send you the updated template. And we are hoping to have some sort of digital form available. There's no sort of clear time frame yet, but we'll let you know when that happens. Tropical Cyclone Alfred. So I just thought I would mention in terms of cold chain breaches. So we received across southeast Queensland, there was over 300 cold chain breaches reported after Tropical Cyclone Alfred, and 72 of those were within Metro North area. So it was a very difficult and challenging time on our end, as I'm sure it was for you guys as well. And thank you so much for your assistance and your patience while it took us time to get back and let you know what to do with all your vaccines. Let's hope that doesn't happen again anytime soon. So staff training, just a reminder that the Queensland Health Immunisation Program, in collaboration with the Cunningham Centre, have 4 immunisation courses that are free to complete. You get a certificate of completion and you get CPD hours awarded as well. Okay, frequently asked questions. So we only had 4 submitted FAQs. So thank you for those who did submit some questions. So the first was if a patient had a full course of Bexzero when they were younger, assuming that that was obviously privately purchased and they're now 15 years old, can they have government-funded Bexzero? So the answer is yes. If they're in the school program and they've missed it, or they're coming to you guys for a catch-up dose, yes, they can have funded Bexzero now. We just want to make sure that it's been at least 8 weeks since they've had any previous doses. And I've just included the link to the MENB program there. The next question was, can pregnant women who do not have Medicare access the funded RSV vaccine? So that's a most definite yes, definitely, please. They can have funded Abrysvo. Eligibility is not linked to Medicare status, and I've included the link which has that wording within the Queensland Health Program as well. Will RSV become part of the NIP for people other than pregnant women? I don't know. We're not aware of any plans at the moment to add it to the NIP, but I guess maybe watch this space. We'll probably know when you know. And the last question was, are there ways to notify new parents about paracetamol before Bexzero, and what other clinics are doing? I guess I'm not sure about what other clinics are doing. I'm not sure if anybody wants to pop any suggestions in the chat. I guess I just thought about considering incorporating the info into your booking or reminder system, or when the mums are coming in for their 7 to 10 day checkup, you could mention it then at that time. I did find some fact sheets that you may consider handing out at that Well Baby Check as well, that talks about if your child's having the meningococcal vaccine today, that there's a recommendation to have the Panadol prior. But I will just remind you that within the Australian Immunisation Handbook, it obviously recommends that Panadol be given 30 minutes before or as soon as possible after. So you can, under the EPA now, administer a dose of Panadol as well, or you can get the parent to duck next door to the chemist, for example, and get some Panadol. So it's not a reason not to vaccinate them. If they haven't had it 30 minutes prior, it can be given as soon as possible after the vaccination. I just thought I would include some other FAQs. We still get a lot of calls about these. So can a child receive the vaccination early? We get calls about this quite often for lots of different reasons, mostly travel related. We would always recommend sticking to the schedule points, but noting that if the minimal interval and the minimum age requirements are met, and particularly if it's required prior to travel, then yes, they can usually be given early and they will usually be accepted on air. We're happy for you to give us a call about that though, because it is sort of a case-by-case basis. And I've just included a link to the minimal acceptable age in infants as well, to the AIH table there. It has been some time since the last vaccine was received. Do we need to restart the course? We're getting this question a lot at the moment with Shingrix. So the answer is no. Please always build on the previous documented doses and don't restart the course, with the only exception for oral cholera. So if you had a patient that received a Shingrix 8 months ago, and they haven't come back in that sort of recommended 2 to 6 timeframe for their second dose, that's okay. Just give that second dose now. An interruption to a vaccination. So if you have a needle, syringe disconnection, or an infant spits or vomits out part of the rotavirus vaccine, what do you do? So the information is pretty clear in the AIH. For an IM or subcut, it says if less than half the dose was administered, give another dose as soon as possible. And for the rotavirus, it says if the infant spits out or vomits only a small part, there's no need to repeat. So it's really a judgment call for the person who's administering the vaccine, but we're happy for you to give us a call if you want to discuss it further. And can individuals receive funded vaccines if they don't have a Medicare card? That's most definitely a yes. So Medicare eligibility seems to, particularly for the state-funded vaccines, it's not linked to Medicare eligibility anymore. So yes, please If they're residing in Queensland, they're eligible for NIP state-funded vaccines, please give them. You can still record the vaccination on air. You'll just need to create a new record, and I've provided a link for how to do that as well. So some general updates. So measles seems to be everywhere at the moment. Obviously within Australia, there's outbreaks in WA. Currently in Victoria, we have had 2 cases so far in Metro North this year, which is 2 more than we would want to have. It's really important to make sure that you're asking or checking if your patients have immunity. So we want everybody to have 2 documented doses of measles vaccine. Again, if you have children travelling, please know that they can have it from 6 months, and that will be a funded dose as well. Japanese encephalitis virus, so eligibility criteria is available online for funded vaccines. Immunisation providers can order the vaccine from QIP in your routine order if you have eligible patients requesting the vaccination. You don't need any specific training or approval to order or administer the JEV vaccines. And I've just included a link to the QIP, so Queensland Health Immunisation Program, are doing some virtual education series, and one of them was on JE as well, so you can access that recording if you want to have a look. Meningococcal ACWY. So a reminder that MEN-Quad-V has replaced Nimenrix on the NIP for the Year 10 cohort, which is usually given through the school immunisation program, and for catch-up doses. Nimenrix continues to be NIP funded for all children 12 months of age and medically at risk. If you do have Nimenrix in your fridge, you can still use it for eligible adolescents. The Australian Immunisation Handbook underwent some extensive updates last week-ish. I haven't had a look through all of the updates, but just when I sort of read through what the updates were, they included several of the disease chapters, administration of vaccination, and quite significant changes to the vaccination for people who are immunocompromised. And there's some additional tables there that discuss the level of immunocompromise as well. So if you haven't already, I'd encourage you to have a look at those updates. The meningococcal B. So I just wanted to mention that the consumer and provider FAQs have been updated. You can access them via the link there. In terms of Bexzero, a reminder that it can be co-administered with routine immunisations, and specifically that's important for children less than 2 years of age. So we are getting a lot of calls from providers who want to separate the vaccine. We want to remind you that it is okay to be co-administered. Obviously, for children less than 2 years of age, there's a recommendation for them to have the Panadol as well. But please, where possible, make that recommendation to the parent to have them together. We have had 7 cases of invasive meningococcal disease reported in Queensland this year, and all have been serogroup B. And I've also included a link to another QIP virtual education series for the Men-B program. That's the bottom link. And so the information from this slide is mostly from that presentation. The Men-B vaccine coverage for last year wasn't great, particularly for adolescents. So in that 15 to 19 year, only 20% of the eligible cohort were vaccinated. It was obviously a lot better at the 2-year point. We had 76% vaccinated, but we really want to make sure that we can improve our coverage. Importantly, the cases of meningococcal disease have been up to date with other routine immunisations, but not Men-B. And I think from memory, 6 out of 7 of those cases reported were actually eligible for funded vaccine. So again, we want to make sure that, if we're giving the vaccine, it's going to work. So please make those recommendations. The eligibility for Men-B is no longer linked to Medicare status, which is great. So your overseas students will be eligible to receive it up to 20 years of age, funded. And also, very importantly, we know that Aboriginal and Torres Strait Islanders are about 3 to 4 times more likely to become unwell with invasive meningococcal disease. And so now all First Nations Queenslanders, regardless of age, are eligible for a funded Bexero course, which is fantastic. I've included the eligibility expansion link there as well, and that's effective immediately. The NCRS resources, if you have concerns from parents about multiple vaccinations, they've got a really good resource about having more than one vaccine at the same time. And then they also have the fantastic resource that you've probably already seen about where to administer which vaccines. I just quickly, how are we going for time? Yep, okay. I just quickly wanted to mention the new vaccine administration error form. So you would be aware and probably have used perhaps the AFI form. And down the bottom or on the second page of the AFI form, you can tick if it was an adverse event or a vaccine administration error. But now if it's just a vaccine administration error, there is a separate form that you guys can complete for that, and that's available now online. If you have an AFI or you have a AFI and a VAE, you can complete all of that on the AFI form. Perfect. Please call or email us. We really are here to help you. We love getting calls from you guys. We love being able to point you in the right direction of where to find all of the information. We certainly do not remember everything off the top of our head, and we have all of the resources at our fingertips. So please give us a call. We really want to help you. And the resources that I've provided, sorry, I learned how to create QR codes, so they've kind of gone a bit overboard there. So just a reminder about the online courses. You can subscribe, the second one for Queensland Health, to the Immunisation Program Update newsletter. The Immunisation Coalition is a fantastic site. The NCRS, they do a weekly newsletter called the Weekly Jab with lots of great information. So if you haven't already subscribed, I would highly recommend that. And also the Sharing Knowledge About Immunisation site is really good, particularly if you've got parents who have concerns about vaccination. There's a lot of healthcare resources on that. Just the references, which pretty much I'd already mentioned where all the info came from. And yes, that is it. I think OMG, just on time. Thanks, Amy.
That's all right. Thanks, Michelle. There's just a couple of questions in the Q&A.
Yep.
The first one.
Oh, sorry. I might stop sharing quickly if that's okay.
Sure.
Yep.
So the first question, for recording a flu vaccine on air, is it NIP/Commonwealth for 6 months to less than 5 years and over 65-year-olds, and state funded for all other age groups?
Yeah, pretty much, unless it's pregnancy. So it would be NIP for NIP, 6 months to 5 years, over 65, Aboriginal and Torres Strait Islanders, medical at risk, and NIP. Otherwise, it would be your state funded. Cool. Hopefully that's answered that.
Audrey's also asked, for catch-up children immunisations, is it acceptable to follow the tool in the Queensland Health on the Queensland Health site and administer as recommended?
Which tool would that be? Sorry, as in the catch-up calculator?
I'm not sure. She's just mentioned QH site. So Audrey, if you're still online, if you wanted to, if you still enter that question in the chat again, or email us, or we email either myself or PHU directly, and can have a chat or give them a call. Yeah. There is another question now. Hi there, Amanda. Amanda's written hi. Sarah asked, does a second dose of the varicella recommended for children if they had their 18-month dose and have no chronic health conditions?
So a second dose of varicella is recommended for everybody, but it's only one dose that's actually funded. So it's certainly a recommendation, but it would need to be privately purchased.
Okay.
I'm hoping that's answered the question.
Okay. Just back to Audrey's question about the follow-up for catch-up children immunisation. She's mentioned, yes, it's the catch-up calculator.
Oh, okay. Yeah, sure. Yes, I use the catch-up calculator to kind of test me and test it from time to time. And I didn't touch on catch-up. Catch-ups are very difficult. We understand that they're incredibly complex. We are more than happy for you to give us a call for any catch-up related or any immunisation related query. But we do get a lot of calls about catch-up. What we would generally say is give it a go first, and certainly that can include putting it into the catch-up calculator. The only thing with that is there will be dollar signs against some of the vaccinations. So if it's got a dollar sign, it might mean that it's recommended, but they have to pay. And because it's a national calculator, it might not, for example, Men B, it might not identify that they would be eligible under the state funded program. So definitely for to use it. But if you've got any queries, particularly about combining vaccines, if there's multiple antigens that are needed, please feel free to give us a call.
Okay. I've had a few questions come through now. So just with MMR on AIH, Priorix and MMR2 still states registered for 12 months and over. Just wanted to check that both can be used for less than 12 months of age for travel.
Priorix, definitely MMR. What I will do is have a look. Sometimes in the AIH, if you go down to variations from product information, it will give you different advice from the product information, but I will get back to you about that one if that's okay. I don't want to give incorrect advice.
Okay, thank you. Melissa has asked if a MMR vaccine is given between 6 to 11 months, is the following 2 doses also funded?
Yes, definitely. So technically the 12 and 18 months are NIP funded, and the one that you give, say, at 10 months prior to travel would be state funded. But yeah, as long as they get all the doses, just give them all funded.
Okay, and just confirming that there is currently no adult funded RSV other than for pregnant women.
No, definitely not at this point in time.
Okay, well, that's all the questions. So thanks everyone for joining today, and Michelle will get back and I'll send it through with the recording and certificates regarding the that question that she was going to check up on. Otherwise, yeah, don't forget, guys, the survey will pop up when you leave. We would really appreciate if you can complete that. It should only take a couple of minutes. And thanks, Michelle, for everything. And see you
No
all next
worries.
time.
Perfect. Thanks, Amy. See you, everyone.
Thanks. Bye.